am here answering questions for a few minutes before I finish up my day. Feel free to leave me a comment, send me a question if you have a question. Once again, Dr. Williams, orthopedic sports surgeon, treating shoulder, hip, and knee injuries. Um, Treat a variety of athletic patients from weekend warriors to professional athletes and anything in between. And when I have some spare time, I jump on here, ask you to send me any questions or comments about random sports injuries, about educating yourself about different things. So I'm here to answer any questions. If you have any questions, please let me know. Otherwise, I'll just get started on my day, which recently finished up. I was in the OR today, had a few cases, taking care of a couple of knee issues, ACL issues mostly is what I see from the knee perspective, treating ACLs. I'm doing a lot of ACL repairs nowadays where I actually sew the ACL together and don't necessarily take the ACL out or reconstruct it. I am able to repair it. And that's been going well with patients. Question, becoming a sports rep, how often do you work with them? I work with sports reps all the time in my cases. We have a lot of equipment that we use reps for, so I work with med reps all the time. So good luck with the career. Sprained my ankle really bad. Been out 3 months. Is it supposed to be weak? So again, I can't tell you specifically about your issue. But if it's been several months with an ankle sprain, usually that requires physical therapy. So probably would need to see someone with a physical therapy background. How do you recover from muscle calf cramp? Calf cramp is usually from dehydration. So making sure you have proper and adequate stretching and hydration is important. Stretching especially. Recently tore my ACL during basketball practice. How soon can I return? So ACLs take, I would say, to my patients, 9 months to recover to go back to sport. And that is really the recovery time to get the ACL back to its normal ligament structure, as well as the function of the leg and getting your strength back. So it can take about 9 months. So again, if I don't answer your question, please send me a DM. I hurt my knee a year ago and it still is not regular. Do I need surgery? I can't answer that question specifically because I'm not your doctor, but if you still have issues with the knee, I'll definitely have it seen by an orthopedic surgeon to have it evaluated, at least by an x-ray. Husband was crushed by heavy equipment, 10 surgeries, about to have his 11th. I'm sorry to hear that. It's a very tough issue to have. Who do I use as my sports med rep? I use Arthrex equipment quite frequently, as well as some other equipment. My specialty is sports medicine, surgery. So I take care of hip, knee, and shoulder issues specifically in athletes who get injured. Just had my second ACL meniscus surgery at 21. What do you think about knees over toes? I mean, I think squatting, I think you're referring to the squatting. I think just making sure that you have a good recovery with strong quads are important to make sure you don't tear it again. How do I recover from a pec strain? Definitely take time to, I would just prevent any kind of excessive eccentric loading of the pec, basically avoiding any kind of flies or anything like that for a while. Why is the back of my knee on the right side of my left popping whenever I run? Can't answer that specifically, but popping your knees is common in a lot of people. Usually it's from the patella not tracking well, and that can be improved with physical therapy to strengthen your quads. Tore my ACL in 2007 due to cheer. Now I have arthritis and I need a knee replacement in 10 years. Sorry to hear that. But ACL tears can lead to arthritis. Not everyone has symptoms from the arthritis after an ACL tear, though, however. How much do doctors make? Depends on the specialty. What to do about subluxating shoulder. If it's subluxing, which is partially dislocating, that means you probably should at least have physical therapy. At the very least, get an evaluation by an orthopedic surgeon to see if there is any tearing of the labrum, which helps to stabilize the shoulder. fracture growth plate in the knee, got 2 screws in it, still hurts 6 months later. Sometimes hardware can be painful for several years afterwards, or several months afterwards. So sometimes the hardware can be removed once the healing has occurred. So it's definitely worth being evaluated for it. Dr. Williams, I'm going through menopause. Why a lot of women suffer frozen shoulder? That's a great question. So question was about menopause and frozen shoulder. So frozen shoulder is very responds to hormonal changes. And that's basically where the shoulder stiffens over time, and estrogen changes can have an effect on it and cause a lot of women in their 40s to develop frozen shoulder. So they're still kind of figuring out why that is the case, but it is definitely very prominent and has a very high prominence in women of menopause age. It's a tough disorder. How do you use your sports medicine vendor? Why do you use the stuff? I like this stuff that I use for my sports medicine vendor, basically. So if I don't get you to comment, just send me a DM, please. Plastics hand is greater than ortho hand. Dope. Ortho hand all the way. How do I recover from a thigh injury? Depends on the thigh injury. I don't know. Rest, ice, compression, elevation. Do you recommend continued hip cortisone injections or hip arthroscopy? That's a great question. So it's been shown that hip cortisone injections actually have a poor response to hip arthroscopy. So I don't necessarily always recommend a hip injection with cortisone, only if people have some early arthritis. So I would not recommend continued hip cortisone injections in general for people with hip arthroscopy issues or hip labrum issues. Grade 3 AC separation, 80% separate. Do I need surgery? Again, I can't give you specific advice on that, but my typical answer for people who have grade 3s and the ones I operate on are people who have significant symptoms, are very uncomfortable and can't have good range of motion. And that is a good indication for me, and patients do pretty well from an AC repair in that situation. My shoulder has full movement, but cracks and pops a lot and always hurts. Again, I get that evaluated, make sure there's no actual history, any injury to the labrum, which is a stabilizing structure in the shoulder. I had meniscus surgery, and 3 years later, I hear crunching when I squat. What can it be? So many times when you have crunching in your knee, that's from some cartilage wear and tear. It's not always a dangerous or concerning issue. A lot of people have cracking in their knees. It's not very painful for a lot of people, but if it's painful and it cracks, it could be significant cartilage damage. Low back injury from lifting large objects, still have pain 3 weeks later. I'm not a spine surgeon, but in general, just stretching and physical therapy and core strengthening for any back issues. You're behind. Yes, I am behind a green screen. I'm not in the operating room right now, but I do have a green screen, but I operate. So you can choose to believe whether or not I operate or not, but this is a green screen. Let me see. Will I get back to full strength in a typical case post biceps repair? Yeah, so biceps repair is very common. I do it commonly, especially in men in their 30s to 40s and 50s, and patients do very well, and they have very little weakness afterwards after it heals. So I would expect you to get back to full strength. So how long do you have to wait before getting a walking boot for a broken fibula that did not require surgery? So it depends. It depends on the fracture. Sometimes the fracture is very stable, and in that case, you get a walking boot right away. But it also depends on the surgery or the injury in general. So it's very variable, I'd say. Do you recommend? Sorry. So again, if I missed your question, just send me a DM. I broke my ankle about 7 months ago and still have issues and pain even after physical therapy. I would get that checked out again by an orthopedic surgeon to make sure that there's no continued fracture there. Had a fall in a pool, shoulder popped, x-ray came out good, but hard to lift my arm. Again, get it checked out, make sure there's no nerve issue or any other damage to the arm, like a labrum, which is one of the stabilizing structures of the knee or shoulder, sorry. What does the future of ortho look like? Will many orthopedic procedures become minimally invasives over time? That's a great question. So I think the future of ortho is definitely something where we use a lot of computer navigation and robot assistance for some of the procedures that we do. We're going to use smaller incisions to do bigger things. So I think that's a great question. It will become minimally invasive, but there are some things like in trauma that cannot be minimally invasive because you need to get exposure to different body parts to appropriately reduce and fix fractures. So some things will get minimally invasive and use more navigation, I think. Um, I ruptured my patella tendon and shredded cartilage 2 years ago, but under my kneecap still hurts. So again, if you injured your cartilage, once your cartilage is injured, it's gone. Unfortunately, it doesn't necessarily grow back. Cartilage does not have the capacity to regenerate on its own. So unfortunately, if you have cartilage issues, they do not spontaneously get better without any intervention. So I just tore my ACL, but I have no pain. So typically ACL injuries, after you get off the initial injury, it's not painful. It's not a painful procedure, or sorry, it's not a painful injury once the initial injury has occurred. And usually patients walk into surgery not having any pain. So that's not why you have ACL surgery or why an ACL is necessary. It's for stability, not for any kind of pain issues. DEI doctor. No, I'll leave that up to you. I'm not a DEI doctor. You can check my credentials. Do you do OATS procedure? I actually did an OATS procedure today. So OATS is a osteochondral allograft transplant for cartilage disorders and cartilage injuries. I perform it frequently for knee injuries, and I just did one today. How many days after meniscus tear surgery are you able to fly? Again, I can't give you specific guidance on that. It depends on your doctor what they say, but I typically allow people to fly pretty soon after meniscus surgery because it's a very low risk procedure. Thoughts on conservative route of PT versus jumping into meniscectomy. So I always offer patients physical therapy whenever I think it's necessary. It depends on the meniscus tear. If it's not a very significant meniscus tear, like a small meniscus tear, I think physical therapy is reasonable to try initially. I suffer from bilateral Achilles tendinosis, the PRP. Any advice? I'd say I would do, physical therapy. If you have significant issues, consider stretching and activity modification, basically. How long does a sprained MCL take to heal? MCLs, if it's a very mild sprain, it can take about 3 weeks to heal. Depends on how severe it is. If it's more severe, it can be up to 4 to 6 weeks on average. So I'm an OT student and interested in sports rehab. Often do you refer patients to us? As occupational therapy is more for hands, so I don't really refer a lot of patients to occupational therapy. I do more physical therapy for shoulder, hip, and knee issues that I see. Separated shoulder type 2, should I get surgery if it still grinds? Again, I can't give you a specific recommendation, but typically if it's truly a type 2 separation, that is not usually a surgical indication. If it truly is painful and there's an issue, it might not be an actual type 2, so to have it reevaluated. So PAO left side, after 6 hip labrum repairs, total hip replacement soon. I don't know what the question is. So I can't understand your question, sorry. Will I fully recover from a torn MPFL? Yeah, so if you have surgery for a torn MPFL, which is the stabilizing ligament of the patella, MPFL reconstruction is a very reliable operation to fix that, and patients do well. Usually 6 to 8 to 9 months or so, you get back and you can play your sport pretty well. So it's a good recovery. Can a hip issue cause groin? So thank you for the heart puff, Cameron. So a hip issue actually does cause groin pain because the hip joint is in the groin. So that's where hip pain is felt. I am not a spine surgeon, so I do not work on spines. Partial ACL tear, no surgery, 8 months out, but still have instability. Should I be concerned? So again, if you have any instability, thanks a lot for the rose and heart, Cameron. So if you have any instability from an ACL, I would really question whether it's a partial tear. Probably is more than a partial tear. So do I need a total hip soon if I've had 6 labrum repairs and a PO? So the whole point of a PAO and a labrum repairs to prolong the need for a total hip replacement. So if it was done correctly and done well, hopefully you can have a prolonged need for a total hip replacement. So hopefully don't need a total hip replacement soon. What is the source of pain that stems from my lower back and shoots to my knee? I can't tell you specifically, but that sounds like it's sciatic or lumbar spine issue, which I am not a spine surgeon. How rare is a torn MPF? It's not rare for an MPFL to tear. It can happen in people who are very flexible. What's your opinion on performing an LET with an ACL reconstruction? That's an excellent question. I perform LETs, which is the lateral extra-articular tenodesis, with ACL reconstruction very commonly, especially in people who are young, so 14-year-olds and up, and people who have very loose joints or people who have significant meniscus injury. So that's a very good question. So LET is kind of a newer procedure that a lot more sports trained doctors are doing. And I think it has a very good role in ACL reconstruction. When I sprained my PCL, stopped hurting on a day-to-day basis and stopped feeling unstable. When will my sprained PCL stop hurting? So the PCL, it just depends on how bad your injury is. If you feel like your PCL is really bothering you and you've done physical therapy and it really is bothering you every single day, I think it's worth considering surgery, especially if you feel unstable. But again, that's in general. It depends on your particular situation. I run, but I'm having Achilles tendonitis. Do bunions cause this pain? I'm not sure. I mean, it could be just your foot strike. It could be a whole bunch of things with your stride. Supraspinatus calcific tendonitis hurts with golf. So when I see calcific tendonitis, I typically send patients to get their calcium barbitage. And I actually had a recent video on this. It's a ultrasound procedure that is very effective for the calcific tendonitis. And I think that's a very effective way to deal with it. Are you familiar with Ehlers-Danlos? Yes, it causes joint laxity. I see a lot of patients with it actually for joint issues. Do I use Mako at all? Mako is a robotic assistance for joint replacement. I used to do a lot of Mako total knees, but I no longer do it. I strictly work on cartilage restoration and not joint replacement at this point. I dislocated my shoulder on Saturday. How long will the pain last, and should I put it in a sling? Again, I can't give you specific recommendations on your shoulder, but in general, when you dislocate your shoulder, it's good to have it immobilized in a sling for a period of time. Definitely follow up with an orthopedic surgeon, and there's a risk of dislocating again once you dislocate it once, especially if you are young. How long does it take a replacement to last? Depends on the replacement. Hip and knee replacements last about at least 25 years, if not longer. And then shoulder replacements are a little bit less than that, but the data on the newer ones are kind of lasting that long. So you can imagine it lasts about 25 years or so. Is surgery life as exciting as Grey's Anatomy portrays it? Of course it is. What would you say about disc herniations and recovering collegiate competitive cheerleading? Based on, there's a lot of explosive jumping and cheerleading. So there's definitely a lot of stress on the spine from that. So if you have surgery on the spine, I think it is possible if you do enough physical therapy. I tore my labrum. Can I be off a sling within a week? So I can't tell you what to do because I'm not your surgeon, but I keep my patients after labrum surgery in a sling for at least 4 weeks. Surgery versus no surgery for torn Achilles. This is an excellent question. I actually tore my Achilles maybe 3 years ago. I elected not to have surgery just because I kind of knew that I would be very compliant with the physical therapy. So that's the main issue. If you're going to do a lot of physical therapy or you're not a competitive like basketball player or a competitive collegiate athlete, I think there is a role for no surgery for an Achilles. But if you cannot do the physical therapy or you're worried about the strength of the leg afterwards, I think Achilles surgery is definitely a good surgery. So it's all kind of depends on your situation. But it definitely is an open area of debate in orthopedics right now. How how to push past stiffness after elbow fracture. So physical therapy really is key for an elbow fracture because elbows get very stiff very quickly. So it's very common to have it happen. Um, and so, what are the risks of having four concussions for basketball? Definitely, if you think of a concussion as a brain injury, the more the brain gets injured, the more long-term effects that it can have. Again, if I don't answer your question, please send me a DM. What other ligament would use to replace a thumb UCL tear? Usually, I think of palmaris, but I'm not a hand surgeon. I can't really answer that question in particular. How long does ACL surgery take? So it depends on how you're doing it and how the surgeon is doing it. On average, hour and a half to 2 hours or so for an ACL. I tore my meniscus at 14, but the doc said I didn't need physical therapy. Um, it just depends on the surgery, but not everyone needs it. I'll check my DMs. For some reason, I don't get all the comments from. I'm on live streaming at YouTube and Instagram, but sometimes it doesn't always populate here. My toes on my left sometimes feel weird and separate like a V. I'm not a foot surgeon, sorry. Just so you know, I'm very specialized in shoulder, hip, and knee. So I'm trying to answer some of these broad questions, but some of them I can't answer. Tips on recovering injured abductor, adductor. So it just rest, stretching, and activity modification. Average recovery for ankle fusion. I don't do ankle fusion, so I can't answer that. Usually you have to get the bone to heal. So it could take at least 3 months at least to kind of start doing any kind of activity. Hey, Doc, how did school look for you and how long was it? Looking at, so again, I did school for 4 years of undergrad, 4 years of med school, 5 years of residency, and a year of fellowship training. So that's the training that I did. I have IT band syndrome. When I run, I cannot bend my knee whatsoever. How do I help with this? Physical therapy for IT band syndrome. Lots of physical therapy. Should I use my wrist at the gym if I have tendonitis in them? I would just take some time off in general if you have tendonitis from anything. So that's just a blanket statement. If you have tendonitis, take time off, ice, physical therapy, and anti-inflammatories if you can tolerate physical therapy and anti-inflammatories. So just skipping around again. If I miss it, please send me a DM. What are the risks of having? Sorry, I had hip labrum surgery 9 months ago, still nagging hip flexor pain and not a lot of strength. So again, typically hip arthroscopy and labrum surgery take about 6 to 9 months of recovery. So if you still have a lot of issues, it's worth talking to the surgeon about or some other surgeon to discuss. Sometimes if you have anterior pain in your hip or groin, it can be because of scarring around the capsule of the hip. So again, I'm skipping around. So if I miss it, let me know. TTO and MPFL reconstruction recovery time. So TTO is a tibiotubercle osteotomy, and an MPFL is a medial patellofemoral ligament reconstruction, and that's for patella instability. That's a common combination that I do for people who have this issue. I would say recovery time is close to around 6 months or so if you're talking about going back to some activities, and 9 months if you're going to more competitive sports. Can I speak on a Hill-Sachs lesion? So Hill-Sachs lesion is from a dislocation of the shoulder. Basically, it is an impacted fragment or fracture of the humeral head as it hits the socket of the shoulder. And that basically is the consequence of dislocating your shoulder. Your shoulder actually gets impacted and fractures on the socket every time you dislocate it. And the bigger the lesion or bigger the fracture, which is called a Hill-Sachs lesion, the more unstable the shoulder can become. So it needs to be dealt with if that's a problem that you have, if you have multiple dislocations. Is there anything you could do for Oscar Slaughter? Oscar Slaughter is a condition that affects basically the insertion of the patella tendon at the shin. It's really stretching, physical therapy, and activity modification. And sometimes it takes the growth plate, which is what the issue is, to completely heal from it. Have you ever heard of upper arm and neck paresthesias? Sure, that's usually from neck pinching of a nerve. Um, so if I had knee subluxation and it still hurts 5 months later, should I get an X-ray? I always recommend an X-ray for any kind of condition that you have. I am 3 repairs in. How can my bones and cartilage continue to need repairs? Um, so it depends, maybe. So sometimes if you need multiple hip scopes, it can be because that there are underlying areas that weren't always addressed or that need addressed. It's hard to know. Um, I have a really bad pain in my tailbone. I've been on the ER twice. Can't tell the reason. I'm not a spine doctor, so I can't really go much into detail. Um, I constantly dislocate my shoulder. So what should I do for treatment? So any person that dislocates their shoulder regularly, I definitely recommend having it addressed by an orthopedic surgeon, at least, and have an MRI. If there is any kind um, of lesion to the labrum, I'd definitely get it addressed with surgery, because it's a very successful surgery for a very, very significant issue that affects your well-being. Um, OCD in the knee, skin gets super hot randomly. Why? Typically, OCD lesion, which is an osteochondral defect, which is an issue with the cartilage, does not necessarily cause skin issues. So I would definitely see somebody for that. Um, what do you think if I hurt my right knee on the inside of my patella? I can't really tell you specifically. Um, just had surgery on my ACL last Thursday. When do you think the everyday pain will start to get easy? Tough. I mean, I think every day should get better in terms of the pain. I would say each day gets better and better in general. But usually by a week to 2 weeks, patients are doing a lot better, certainly by 2 weeks. What do you think? So symptoms of foot stress fracture in a runner. So stress fracture can happen in any bone, especially in lower extremity bones, especially in runners who run a long distance. Um, and usually I place runners or anyone with any kind of stress fracture in a walking boot if the pain is reasonable, or if it's significant, definitely offload them even more with crutches. So I have about 5 more minutes. So I'm skipping around once again. So I'll keep on getting this question. How long till you can play from a fractured fibula? So fractured fibula depends on the severity of the fracture and depends on how well it's healed. So it all depends on kind of the x-ray and pain as well. So bones take at least 6 weeks to heal. So that is a very minimum amount of time, I would say, from a fracture, if it is significant in any way. Knee muscle twitches that come and go. Any ideas to why? Again, it's hard to say. That's very non-specific. Can be from dehydration, can be from electrolyte imbalance. Knee still buckles 4 months post quad tendon repair. Buckling the knees is usually from some sort of weakness. So it sounds like some sort of physical therapy needs to be addressed to increase the quad strength. Why did doctors say I partially tore my ACL, but it's considered a sprain? So for us, sprains are just one end of it's like one continuum. Either you sprained it or you tore it. It's kind of in between. So a sprain is literally a tear is literally a bad sprain. So it's kind of a semantic issue. Fell my ankle at practice and can't put pressure on the side. Should I get an X-ray? If you can't put pressure in any lower extremity, I definitely recommend an X-ray with anyone. Right shoulder labrum tear with surgery. How can I keep it healthy while playing football? I think the best you can do in general is to do physical therapy and strengthen your shoulder in general. I would just keep that in mind. I have about 2 minutes left. How do you assess return to sports after ACL reconstruction? That's a great question. So there are a series of tests that you can do. Basically, you want to test to make sure that the operative side is as strong, almost 85 to 90% as strong as the non-operative side. So that's a very kind of crude way that I can tell that patients are ready for sports, and that's usually around the 9-month mark. Can I heal a rotator cuff tear without surgery? Well, it won't heal. The question is, will it be symptomatic? And there is good evidence that physical therapy can help from the pain of a rotator cuff tear. But really, if it's an acute rotator cuff tear, or if you are very limited by it, surgery is a very good option for that in general. Best advice for someone who wants to be in my profession, I'd say work hard and do research. I golf a lot and have bad wrist pain, and my wrist is clicking when I move it. Can be a sprain in between one of the bones, or between two of the bones in the wrist. So get it checked out by a hand surgeon if that's an issue. The trainers carry traction splints or only soft splints. It depends on the trainer. Sometimes mostly they have soft splints in general. All right. So I have to head out. I'll take one more question. So if you haven't guessed, I do a lot of ACL surgery, so I like these ACL questions. How long is recovery for ACL surgery? Is the question. That ACL reconstruction with meniscus repair. So how long is recovery for ACL reconstruction with meniscus repair after manipulation of anesthesia and lysis of adhesion? So sounds like this person had stiffness after surgery. So stiffness after surgery is tough after an ACL reconstruction, but the recovery, as long as it gets your range of motion back, the recovery pretty much mirrors what it would be normally, which is 9 to 12 months. But that is all dependent on whether or not you get your range of motion back. How do I fix the slap tear shoulder? Physical therapy to try to see if that pain gets better, and activity modification. If not, it may need surgery if that doesn't get better with the physical therapy and activity modification. So sorry if I didn't get to your questions or comments. Please forgive me. Don't have a lot of time here. Got a lot of questions here. So if you have questions that you still want to answer, please send me a DM or comment on my page. I'll try to get to most of them. And I appreciate you guys for listening and putting up with my green screen, which a lot of people had a lot of strong feelings about. But this is definitely a green screen, but I do operate. I'm not operating currently right now. I'm not in the operating room. So I'll try to jump on this another time when I have free time, but I got to go now. Thanks. Bye.